Welcome. We are going to give people a couple of minutes to file in and join us. We do, as you're getting in and getting settled, I feel free to introduce yourself in the chat. We know, especially for this webinar topic, thinking about women's health products, we've got a lot of folks who are deep in it, who are working on projects, who are intimately connected with the problems that they are solving. And so we want to also facilitate space for you all to connect with each other. So feel free to introduce yourself in the chat. As we get into it, I do need to introduce myself. My name is Hillary. I am part of the team at Xmartlabs that organized this event. Xmartlabs is a dev studio that offers services and product consulting, especially to startups who are specializing in digital health and wellness platforms. So if you are building something and trying to accelerate your build, scale quickly, or prove your concept, Xmartlabs helps to ease the load of development so that you can focus on growing the business without spending all your time in the code. So we're excited to have you all here. We are also co-hosting this event with Stripe. You've probably heard of Stripe before, the thing that lets you swipe your cards. Not everybody knows that Stripe has a really robust suite of tools for startups, and that's actually what Michelle Thing does at Stripe. So we're excited to have her here, and we do have some special offers in the follow-up email that we'll send on Monday. So look out for those, and it may include a discount for some Stripe services. So with that, I think that gets all of our announcements out of the way. I will pass it over to Michelle.
Thank you so much, Hillary. And it's so great to be here supporting this community and supporting women's health. I know it's from our survey responses, we're already seeing that it can mean so many different things to different people. And thankfully, we are coming out of this time where it's not just fertility and period products. And so we're joined by an incredible panel. And by way of introduction, can each of you give a quick, brief overview of what you're working on right now or a most recent project in the space? Let's start with Jennifer.
Hey everyone, happy to be here. I'm Jen Gibson, and I've been in the health tech space about 18 years. I have worked in women's health, building women's projects and products for a long time in different orgs, including at early stage companies like Lovu Health, where I was the chief product officer and was responsible for developing out our mobile app for users and also our AI-driven navigation coordination system. And I've also worked at larger orgs like Apple, where I developed our women's health clinical programs for the on-site primary care clinics. So looking forward to the conversation. I'll pass to Lizzie.
Hey there, I'm Lizzie, and I'm the founder and CEO of SyncIn, which is a fitness platform all aligned with female physiology. And so I have a background in tech from Meta and Roblox, as well as previously was a dance or fitness instructor. So bringing everything together, and I'm sure like many on the call have had their own health journey as well for why we're in this space. So putting it all together, and we are pre-launch. So that's my contribution to this conversation. And I can pass it off to Carla.
Great, thank you. So grateful for the opportunity to be here. So my background is bringing medical technology to market. So everything from diagnostics to devices to digital health. I help advise early stage companies really with a focus on customer validation, customer discovery, go to market, and the pathway to payment, because ultimately we all have to get paid for our technology. I'm really passionate about improving health outcomes, advancing all health, and really driving equitable access. And so excited about the world of digital health, just being able to go beyond boundaries and really bring care to areas where they may be underserved. So right now I'm just working on with a couple different founders, one that's working on a non-hormonal vaginal ring, as well as another working on FU Cancer, who I think may have joined, on a cancer wellness app, really trying to give patients and caregivers expert guided support in nutrition, mental health, and physical activity. So I'm excited to be here and be part of the journey and discussion. I'll turn it over to Mariana.
Hi, everyone. My name is Mariana Carpola, and I am the founder of Moment for Parents. Our mission is to ensure that no parent suffers silently from mental health disorders. And so our app coaches moms through pregnancy and postpartum with an emphasis on emotional well-being. And we have grown our app primarily through NIH grants. So we've received $1.3 million in NIH grant funding to kind of build out the product, build out the evidence base with the long-term goal of selling into health insurers.
Amazing. And Carla, let's start with you first, since you're a growth strategist and a lot of our audience members here today are that founder demographic. What are the first things that you say to a founder who is building in the women's health space? What do you look for in a really watertight monetization strategy?
So I think ultimately it starts with the problem that we're trying to solve and really thinking about, validating the market assumptions and having market truth of what it is, because I think we all, come from it when women's health, a lot of times developing the technologies from our own personal experiences. So, really focusing on a diverse population and diverse stakeholder feedback, because it may be caregivers, it may be payers, it may be employers. So, it's really three areas: is really validating the market assumption, building monetization and access from day one, because that needs to be part of the product strategy and the development and the roadmap from a product strategy standpoint. And then I think the third one is really coming at it from a lens of market shaping versus market entry, because many times especially when it comes to women's health, we may not just be entering a market, we may be shaping and building it because it's a market that's been unmet and underserved for a number of years. So those are kind of the three main buckets, and really thinking about mapping out the ideal customer profile and gathering data along the way, and really not over engineering when it comes to digital health. If you can think about mapping the MVP and getting data about utilization. Of course, all of this would change, and we don't have enough time to talk about it today, but a lot of it also will be different if it's a wellness app. It will be different if it's a digital therapeutic or it has a regulatory component to it. So trying to de-risk as much as possible from the beginning to show the traction that will be interesting to adoption and investment.
Incredible. I think you touch on a really good point, which is so much is changing. And again, we're already seeing the definition of women's health really shift in terms of the methods and products and offerings. And actually, Jennifer, since you're working on an health app, can you share more about the different monetization models? So, like wellness or digital health or digital therapeutics, like what does that look like?
Yeah, definitely. And Carla did a great job of setting me up for that question, talking a little bit about it. But there's really, three different categories to think of in terms of where your digital health app is going to land. There's the wellness segment, and that's really the place that's non-regulated. It's typically B2C, so direct to consumer market for those types of apps. There are often subscription models there. So it can be a monthly subscription or annual subscription. A company like Him and Hers, the Hers portion of it for women's health is a great example of kind of more of a subscription model. And then there's also those types of apps that are freemium and have in-app like upgrades or purchases to be able to access additional features. A lot of the period tracking apps fall in that category. So like Flow, for instance, is a good example where you can use the app for free, but you're upgrading to use additional features. Some of the older models around like one-time purchasing seem to have like gone out a little bit of favor. And then there's a lot of movement into more of the corporate wellness space for wellness apps. And those are things like Headspace, where they're really deploying out to like large employers for well-being benefits. I think the second category of digital wellness apps are kind of the digital health component. So there you're really leaning into clinical protocols and process, but it's not regulated by the FDA. So you're kind of avoiding that crossover of the line into regulation. And those are a lot of B2B apps. So those are out to employer plans, it's out to payer plans. And those are often situated in like a PEPM, per employee per month model, or a per user per month model, PUPM. And the example of that is like Maven Clinic, one of the amazing unicorns in the women's health space. And they've really monetized that model incredibly effectively there. And then there's also value-based outcome models that have been rolled out in that space. So that was something we did when I worked at Vita Health. And we wanted to get our foot in the door with a payer. So we had a contract with United Healthcare where it was very incentivized by what outcomes we would reach through the course of our contract with them, which was a year. And so most of our payments happened at the end of that year when we met all of those incentives. And then that third category is, like Carla mentioned, the regulated space. That's where you really need a lot of clinical validation and evidence, and you need to go through FDA clearance in order to get there. It's a really exciting space. I think it's tons of research happening in women's health, and it's a really amazing place to see so much movement. And those monetizations there typically are prescription based. So it's like a clinician writing a prescription that's then reimbursed by a payer. And so like Hinge Health is an example of that, maybe for physical therapy for pelvic floor. And then there's also like per course of treatment. So sometimes those are a little bit more standardized for like how many treatments somebody gets that gets reimbursed. I know Origin's one company that's done that really well. And then there's the whole billing sector of things for like remote patient monitoring or RPM billing. And that's where you are connected to a clinical operational component, and then you're billing on behalf of that clinic for either time or for data. And so that was the model we built at Lovu Health, where we deployed all the navigation services, we did all the time, we collected all the data, and then we passed that billing through the OBGYN office for reimbursement. So that was a very quick range of things, and would love to ask the panelists on the call if there was anything I missed or any other models you would point out that you've seen emerging.
I thought that was great. That was an amazing oversummary. But Carla, do you want?
No, that's great. I was thinking, and that's why, when it's that validating the market assumptions, I love the ecosystem mapping, and I'm a visual person, so usually I'm writing everything out because so many times we might think of just the patient or the caregiver and thinking about, how do you drive an alliance with the patient advocacy groups and thinking about reimbursement as policy coding and payment. So it's everything about thinking about, okay, well, how am I going to get paid for this and who's going to pay for it? Maybe now, today, but who's going to be my second payer? And maybe you start with a wellness and then you evolve to a digital therapeutic. And that's what happens a lot of times, right? Because you have you can get quicker to market. And what Jennifer outlined is really defining that category and thinking of that payment. And then thinking about alliance as you think about pilots, whether it's hospital pilots, if it's a cancer society, if it's if it's a disease condition that you are working on and thinking about it, because these are also different stakeholders that will be influencers on the payment process and the adoption, guidelines in some of those areas. So I think you covered it nicely, Jennifer, of how it's going to, how it's going to look. And I think a lot of people get panicky. But then it's a journey, right? You don't need to solve all of it. And it's kind of like, I think of it the sandwich. You're layering it onto each other. And I think the only other comment I would add is that's why also it's thinking about if you are going to have an app that works in the healthcare system, getting feedback from those clinicians. We have an overburdened healthcare system right now. So you want to alleviate burden and you want stakeholders. You want to think about like, what are they doing every day? What are the jobs that they need to be done? And so that would help, and I'm excited to hear from the founders panelists too, of how they incorporated this feedback.
Yeah. And I would just add oh, sorry, go ahead, Marianne.
Well, I was gonna, yeah, I think both of Jennifer and Carla, you did a nice job of like painting the big landscape, but then when you are in the trenches, it's never so neat. as I am this type of founder with this type of business model, and it will stay that way for long term. I think especially early on, so much of it is really scrappy. Like I said, we've relied on grant funding to build out our product. I know many Series C stage health tech startups that don't necessarily have a long-term contract with any one healthcare organization, but they're still alive. So it looks very different. And, you know, and even though you're kind of working within that scrappiness, you do need to be somewhat strategic of like, okay, if my long-term goal is to be reimbursed by Medicaid, and I'm going direct to consumer with individuals who are, high income, well educated. Like those are two different populations. And, in many other, realms that wouldn't matter so much, but in health it does. So you need to be scrappy, but you also need to be mindful of how are your actions today going to connect you and give you those long-term opportunities so that the data or, whatever case studies you might have are actually relevant in those conversations.
Yeah, I love the highlight of that balance. It's so important. And definitely the long-term goals and then also the short-term goals. Like, are we in the middle of fundraising? Like, do we need to get people on platforms so that we're meeting these numbers that our investors are asking us to have before they fund us? It's also just a reality of early stage companies of having to strike that balance.
And I'd love to get more of a peek behind the curtains for both Lizzie and Mariana. You talk about having to be scrappy, but also knowing where your kind of long-term path is. How did you both start mapping that path to monetization? What did you pick first, and do you think it was the right choice?
Do you want me to start it off, Mariana? Then I'll pass it off. So yeah, so we are, in terms of what Jennifer just outlined, we're in the wellness category. And so focusing there intentionally, because then we can be closest to our users. I have a product background, and what my heart wants to do is for women to feel great in their bodies. And so for that to, in order to achieve that, we need to connect with those users and be able to provide the product that is aligned. As Jennifer was mentioning, Headspace is able to go to insurance, but the product is absolutely stellar and totally hits and already has product market fit. So in terms of when I'm developing a product, I need to make sure that I'm very close to the user, and direct to consumer allowed that to happen. So I'm intentionally starting that route, and then with having traction can look into other areas to expand, of working with collegiate programs with the NCAA, or if I do want to go into the insurance route, but also can see from the users what they're using, what I want to double down on to then be able to expand and go into potentially B2B or different areas, but really wanting to keep that close iteration. So that's how I've been approaching to get started. Mariana, do you want to continue with some of your process?
Yeah, I mean, we started very much as a mission-based organization. So, I went through my own journey through with mental health through pregnancy and postpartum and just realized how little attention is paid to it. And so set out, how do we solve this problem? And so, in a way, to solve that problem, you need to solve it at scale. And, the answers are either insurance, health systems, or employers. When I But even so, having come from health tech, I knew that getting in the door with any of those stakeholders, I had to have D2C data, and I also needed to have evidence-based back data. And so that sort of set our course, similar to Lizzie, of like, okay, let's build a product that has great traction, that has great usability, feedback, et cetera, from users. And then that is something that we can turn around and start talking to these other stakeholders. I started my company in 2019, and since then, I think there's been some huge changes with a lot of those stakeholders. I mean, in employers pre-2020, I think were very receptive to digital health solutions. I think a lot of them are burnt out at this point, so especially point solutions like maternal mental health. So that's really not something that we're chasing anymore. And really, now we're starting to focus much more on Medicaid in particular because there are certain states that have regulations that, all Medicaid covered pregnant and postpartum individuals need to be screened for mental health. So, it's just really being strategic about the intersection of the product that you're building and what types of, yeah, policies, regulations, et cetera, that can like motivate stakeholders to look at your product.
Yeah, and I can share too of how we've been structuring what we're actually going to price it at is definitely looking at competitors and seeing where they're at. I'm kind of at this interesting balance of looking at adjacent competitors because nothing is like a true head-to-head type of thing, but looking at cycle tracking apps, what are they doing? What are fitness apps doing? And even what are habit tracking apps, seeing what people are already typically paying because I also very much feel there's places to invent the wheel but places not to invent the wheel. And pricing is one of like, to do tried and true methods type of thing. And already knowing the different areas of each division that Jennifer was mentioning. And I would probably recommend talking with as many higher up experts who know those nuanced details, especially in the clinical space. I'm not going to the clinical space, but I know if I do, there are so many regulations and you need to like really know them. And if you don't, like, we all have the same goals of making women feel great in their bodies. So we don't want to see founders not leverage the right information. So, anyways, I'm intentionally staying in my area so that I can have a chance of succeeding for it. But looking at these competitors and then also looking at where the differentiator is and what it is and being able to leverage that. And is that actually differentiation of price or is it of just what the product is offering and being able to market to the user what that differentiation is? So that's what I've been using as my mindset
And
for approaching.
I would just add there, and I think this is a great point also, Mariana and Lucy, that you brought up of, there people are burnt out, employers are burnt out, right? And so thinking about how do you bring differentiation and the value, and I think if we look at trends, there's been this shift of, kind of soft impact to be able to show ROI driven impact. So whether it's return to work, reduced absenteeism, thinking about the total cost of payment to the payers, thinking about that. And maybe Lizzie and Mariana, not to put you on the spot, but can you maybe comment about how did you capture data and what's your data about whether it's utilization when you were building your MVP, but also how are you capturing that data to also bring that story to payers and monetize it?
So because we're grant funded, there, well, it's part of the process is collecting all of that data. So the endpoints that we are trying to track are adherence to mental health screening and adherence to social determinants of health screening. So, if you rewind back to what Jennifer laid out earlier, we're not a digital therapeutic. We're not trying to prevent or cure maternal mental health disorders. We're really just trying to make sure that all moms are screened throughout pregnancy and up to 3 years postpartum. And so all of our studies are designed around engagement and retention initially as kind of those usability outcomes. But then the follow-on outcomes are screening adherence to say, hey, like we're going to keep monitoring these moms and then connect them to resources when needed. So I feel like aside from the usability metrics, retention, engagement, those are pretty standard industry wide, especially for apps. But once it gets down to that ROI piece, it's going to be really dependent on what you're trying to impact. And so I think for our phase 2 studies, we'll be looking at doing a trial with like a self-insured employer and doing pre-post claims analysis to show, hey, and then also surveys to track some of that the presenteeism, absenteeism, some of those employer-based metrics, so that we can put together and really connect the dots, because that's what's not happening today between, hey, if we screen moms early, we catch them, we get them to treatment, we're going to avoid things like preterm birth, preeclampsia, just these higher risk and really expensive outcomes.
That's
Mariana
such a
covered it. Yeah.
good I was just going to mention, I love that walkthrough of like the trajectory of like stages of companies, like where you're getting the outcomes and the data, and now it opens up this opportunity for you to go to the payer and or the employer improve outcomes for claims. So a great articulation of that. Sorry, Lizzie.
No, I was just saying that that was it. Those the direct to consumer, those traction numbers are going to come up in conversation always. Like if you're going that route, that's what is going to be expected. And if you're not hitting them, you're going to be working towards hitting them. So I feel like that's not going anywhere.
And I would just add to that. I mean, I don't know, Lizzie, how many, if like your user experience, but like we have so much trash data, like of bots, of like who knows what in terms of like users in our backend. And so, I mean, this was an unforeseen positive outcome of doing this study is that it really reins in like a very clear parameters of like we know this user is consented. We're not incentivizing them to use the app. They're just, to fill out a survey. So it's like I feel like having that structure has really helped us because if you could arguably say that we have like thousands upon thousands of users, but if I really look at those, I'm like, no, these are bots or like people from foreign countries trying to join our study. Like it's a weird world out there when it comes to user data.
No, and finding the right people who can help decipher that for you and try and set that up early instead of like after the fact trying to undo it, but of like it continuously. So having that like hopefully strong also because my background was user research, so I worked really closely with the data scientists who are on it, and I was on the research side, and knowing what users say and what they do are very different. And so looking at those data numbers and you're like, oh my goodness, I have all these things. And then you're looking closer and it's actually different. But then if we do have our core people, they maybe, if I'm interviewing them, are saying something entirely different from what their actions are showing. It's like, I'm sorry, you say you log in all the time. I can literally see your data that you are not. And so, of understanding that, but both sides are extremely important. One can understand the what is happening of that data when the why is from these qualitative and really having a close feedback loop with certain segment groups of your users. You don't need to individually interview every single person, but definitely having a sample size of the segment target group can help then inform that why. And then hopefully you can also do additional of actual evaluating that pricing too, and if pricing was a factor or if it's the product or to understand users behaviors, because if no one's using it, again, those traction numbers suck and then everyone doesn't like to talk to you and you're like, great. So yeah.
Yeah, and doing it early and iterate, right? Like I've seen sometimes things be over-engineered, and then you develop and spend all this money on the product, and then maybe 60% of the features might not be used. So I think that scrappiness and the agility to get the MVP, iterate, get the feedback, and hear it. I always a lot of times on the focus groups bring a separate person with me too, because you always hear different things, right? Or you see someone's body language or when you ask the questions. So thinking about that user and that human factors aspect is so important.
A great tip. Yeah. If you go in and you have a hypothesis, you're going to listen for the things that are validating your hypothesis. Neutral party is always helpful for that.
And so let's say you're operating as D2C and you want to get to the B2B side. When it comes to packaging this data or even approaching these types of conversations, including funders as well, like how do you navigate that?
It's actually very similar to just straight up user research as well. I mean, it's customer research. We participated in a program called iCore, which is this intense, customer discovery. We interviewed 100 B2B stakeholders over the summer, and it was invaluable, and they're just introductory interviews where you're asking, you know, what what are the policies that are influencing your decisions or data tracking or why does this matter to the bottom line of the company, et cetera. Like I mean you can't really present data until you know what is going on within each organization. And then the other very difficult reality of working in health is these sales cycles are long. And a lot of them are very, very relationship driven. And so if you're waiting for your product to be ready to start having those conversations, like you're too late. Like you need to be having those conversations as early as possible to be like, hey, like, we're planning on putting this type of study together. What do you think of this endpoints? Like, what would you change? Like, how would you decide? Like, really, it has to be as participatory as possible with those B2B stakeholders. And yeah, like if there's conferences that you can plug into or networks, or I mean, like I worked in health tech, but I didn't come from, insurance or health in like clinical perspective. And so if you're coming from that lens, like maintaining those relationships so that you can use those to inform that discovery process and get some early B2B customers too.
Also knowing so much is relationship based. This is just an observation from a company I was at previously, Verta Health of reversing diabetes. I really respect them. And I remember them hiring and they were doing the insurance route. And they were very specific that they want to hire salespeople who had done insurance. And I was early in my career and I was kind of like, why do they need that? If they're good at something, couldn't they be good at it? But the root behind it was those relationships that they had built and that they knew how to communicate to that person and knew what they were looking for because that just takes time to understand. Obviously, it can be learned. You can learn it and you can start it, but you have to start it to be able to do it. And they were just looking for that execution to be able to happen as soon as possible. But that's where things get really nichey, and it's like I am sales for this specific area. Yeah, I can let others speak.
Well, and I was just going to say on that point also, it's that expertise because I'm thinking, I'm sure the founders were throwing a lot of things out there and there's so much, right? But it doesn't mean you have to do it all at once. It's really that if you're trying to also go to angels or get the fundraising, it's more to also acknowledge the fact that you thought about these different things, right? And that you have a plan in place and it's also thinking about your funding needs to get these specific elements in place. But I think on that point that Lizzie said also, and I'm sure Mariana, you see this at the state level, getting people who have experience in working with Medicaid or working with the waiver, what is it, the waiver 11, working with there are different, and these are things I've just learned over the last couple of years. I was global, I was out of the country for about 10 years and I returned back 5 years ago, but these state plans, and thinking about where do I launch first? Where is the state that's favorable? Or where is somewhere that's favorable? So it's also thinking about from a market access standpoint in your ideal customer profiles, like where do you launch? Are you going to do a blanket big launch? Are you going to do narrow to do some learning? So, I don't know if the team, the founders also, or Jennifer, you have comments about thinking about how to stage your launch as well to ensure success.
I have thoughts on this because you kind of articulated what I'm going through. So I am intentionally, I have on my I've mapped out different options for B2B of what it could look like. And I have to make sure the next step actually gets achieved. So this is on my, I will reevaluate this in 4 months type of thing. Even though would it be dream world if I could also do this and start doing it, but also I need to get the product over the threshold. And so I have to make that the priority right now and then see this future direction, but also know there's another time that I'll pick up the hat to truly, truly put it on. And so that's where I'm at for that part of it.
Yeah, I would add on to that as like a very tactical suggestion. There's a book called Traction that the entrepreneurial operating system where they like present this idea of like establishing rocks. So each quarter you have like, up to five, but really just three main goals. And the more you can like build that type of layering into your how you structure your work, the more sanity you will have. Because I mean, you can't do it all at once. And so any kind of yeah, so like I've this year flipped back and forth where one quarter I was really focused on the D2C side, the next quarter I was more on the B2B side. Maybe that's something that you switch monthly or every other week. Like you got to find your own flow and like whatever stage your business is at that will evolve as well. But yeah, just chewing off what you can is okay. I think the other point that I wanted to add to Carla, your point of like, is it statewide? Is it, nationally? And our earlier conversation about networks, also plugging into the advocacy group or nonprofits that are working in your space. So for us, that's Postpartum Support International. And so they have chapters across the country, and I've connected with those chapter leaders to just hear, hey, what's going on in your state? What policies are getting changed? Like there's so many stakeholders in healthcare and trying to leverage those in different ways to continue to learn and find the like unknown opportunities. Because going back to my your point about scrappiness, like sometimes there are special pots of money through some foundation or the state Medicaid agency or something that might be an opportunity or good fit for what you're building. And without building those relationships, you wouldn't know about those types of opportunities. So, yeah, just keep up the scrappiness.
Yeah, I'll also say from the fundraising side that everyone absolutely poo-poos direct to consumer. Like I talk to everyone and they're like, direct to consumer, it's B2B is where it's at. It's like, yes, I know, because we already had talked on this call that the large scale is able to like totally lock into place when you can do that, but there's a time. I very much feel like there's a time and place in order to be able to do that. And I'm not at that place yet. I still need to make sure everything's totally nailing. I'm having the right product market fit before I start engaging in these different kinds of conversations. So it's also finding those investors who understand that, and some have, and they're like, they're like, so a lot are like, they're like, yeah, that's the way to go, but they're like, I still suck that you have to do direct to consumer. They're like, and they still have so much. I think everyone has like PTSD from it, or they're freaked out by it, or just they're like, that's so hard. I just hear people and like, they mean to be helpful, but they're just like, that's really hard. I was like, thank you. I just swallowed a rock now, and this is still what I'm doing. But they're like, but that's the best choice. That's what you got to do. And I'm like, okay, cool.
Well,
So,
and the resilience, right? Because it's been discounted. I mean, the unmet need and the challenges from a women's health have been discounted and continue to be discounted. The great positive is that we have success stories, we have unicorns, we have traction, and we also have investment that's being made there. So we'll always continue to hear, oh, like our period's really a problem. And then, a lot of the people that are funding have children now and also have daughters, right? So I think it's thinking about that resilience and continuing to demonstrate, and that's why I always go back to the data and being able to demonstrate the data. And also, like to your point, Lizzie, you have to start D2C to some extent too, because just to get that traction. Otherwise, if you start on the B2B and go down the regulatory path, it's like 5 years from now. So resilience is such a key concept as well.
I do have to tell myself all the time, I'm like, long game, long game. You're in this for the long game. This is not a short win, even though I would love short wins, but it's like, I really have to. I'm like, I'm doing this for my 10-year from now self. All of this building and understanding.
So I think it's a really important point for early stage founders to understand that investor pressure on the B2B side. I hear that all the time. Because B2B, you can have large impact with one contract. So that's of course where they want you to drive to. So as others have said, the data, proving your data with early users to show impact. And then I think on the B2B side, Mariana brought this up earlier, but there's tons of fatigue with point solutions. So these HR teams are managing 30 point solutions that they're trying to get, and they haven't seen the ROI for it, and they're having a hard time, wanting to add in new solutions. And so I think being able to show that impact on claims for those self-insured employers and for payers is going to be the only foot in the door for B2B going forward, is being able to show that you're going to have impact in those segments of the population at a much longer term level.
Jennifer, you talked about that before last time too. This was actually the first call I've been on that says B2B doesn't have as much return as what we think. Is it the investors are still just like old school thinking?
When it works, it's amazing, right? Like when you're a maven and you get in and you dominate the B2B markets, like you become a unicorn. So like it's a formula that's worked really well and been super successful. I think the real challenge is when you're an early company and you're trying to talk to those employers and have those conversations, it's very hard to get to that point of contract. And then when you go to like a per user per month model, for instance, where you're kind of going in the door by saying you can pay me on the amount of people that are using, that employer doesn't have incentive to get users on your platform. So then it's a little bit of a catch-22 because now it's not showing, you're not showing a lot of traction in their population. So I think the way that we think about B2B and the contracts that we do are going to have some fundamental shifts, especially for early stage companies.
Well, that's why I think also it's thinking about, what is the engagement with the payer also, and it's going to also depend on the disease condition, the total cost, because then it's in innovative business models. There's a company that's up here in Kirkland that's a PTSD app or digital therapeutics. So the partnership with payers, because if you can then track the outcome or the impact of reduced emergency room visits, reduced outpatient visits, or even I've seen a mental health app in LA County. They partnered with the county for return to work. So it's really thinking about, who is it ultimately that also has the incentive and who is it that's positively or negatively impacted. So that's, I think that's why mapping it out and then thinking about who can drive it, because the payer then can, think about how do I triage the patients that need this, and then they push the app to the patients. And that particular company also has a lot of data to support the clinical evidence of the impact.
I would then also say momentum is momentum. Like if there's momentum in somewhere small that you just kind of said, it's like that momentum could grow into something larger. And so each person has their own areas where momentum's easiest to build. And so like even if someone's building exactly what I'm building, they might have a totally different background and they already have connections and their momentum's in a different way. So I think there's also understanding the team's biggest space for momentum, but momentum is momentum and to go with it.
And I think the other rationale in terms of like starting D2C before going to B2B is like Jennifer was explaining, more often those than not, those contracts are still relying on you to do the marketing to the end user. I mean, it's really B2B to C. And so you're not getting away from that to C marketing component. So you kind of need to learn what works, like what channels, what messages, what, you know, I don't know, features to promote, what incentivizes people for retention and long-term use, like all of that learning you need to have under your belt before you take on a big contract that, could take a lot of your time to put together. And then if you don't renew it's you're not going to build a successful business model that way. So even though it is hard and frustrating to go to the D2C route, it's like those are just necessary learnings to make any of these products work long term.
I know we can keep going on, and I do want to be conscious about the amount of time we have left. And I want to make sure that we make enough time for the audience to share any of their questions. So while we wrap up with one final kind of rapid round question, for anyone in the audience, if you do have a question for the panelists, please do think about that and put that in the Q&A, and then I'll read them out loud. But just a quick round robin to end us off. Can you share a word of wisdom?
I would say community groups and know also when to absorb information and times also just to like do it and execute and trust yourself for it.
Yeah, I would say something I've been telling a lot of the early stage companies I work with is like technology is no longer your moat. Your moat needs to be data and speed because with the kind of tools that we have, you can pop up an app that's perfectly replicated to yours over the weekend. So if you, as others have talked about, that data integrity and really making sure that you're collecting outcomes and data and then moving fast in the areas you're getting traction are the ways you're going to end up winning.
I think just building on that, on the community, I think, it can get very lonely out there. So building that community as founders also, and people are willing to help. So I think, we can all get super busy and we do a lot of remote. So building that community and the traction and the data and pathway to payment. So with that is always keeping that hat on of who's going to pay for it. Are my assumptions right? And I'll pass it to Mariana with that thought.
Yeah, I would say monetize as early as possible. Just don't wait to build the perfect app or the perfect whatever. What is the most simple version of the thing that you're building? And maybe it's just a webinar on the topic that you're talking about. Like, how do you build an audience? How do you show that people are interested in this problem and willing to pay for it as early as possible? Because then you're getting money in the bank to continue to build the rest of the thing. You're not getting into like these, qualms of having to fundraise. You can bootstrap longer. And then, yeah, just stick it out for the long haul.
Amazing. It looks like we have one question from the audience, asking about stakeholders and prioritizing their different needs. How do you go about that?
Well, I can answer. So get a Sharpie, or not a Sharpie, a whiteboard one, and map it out and think about all the different groups and bring your team in. So I think it's important to think about the different stakeholders, what the anticipated impact is, and what their needs are, and the anticipated impact. What are the metrics that you need? And then also the level of influence that they may have. So I think if there's a lot of great resources that are out there, like stakeholder mapping. If you do where you can put it in quadrants based on their influence. So my recommendation would be to do that. I know also Mariana mentioned the iCore. That is a program that's available for people as well, that they help do the customer discovery. But it's going to be through having some of the discussions to also think about.
And then we have another question. Are there specific differences you've seen in women's health versus the broader health tech category?
I think the lack of data, women's health has just been underfunded, under-researched. A lot of, I don't know, we didn't talk about this, but like historically, men and women were just considered the same. So in many studies, there was no evaluation of the health differences or outcomes between men and women. And so as a result, many insurers employ it, they don't even realize that some of these issues are a problem. So like for maternal mental health, for example, insurers actually don't even have their internal data to make any ROI assessments on health impacts. So there's a lot of missing data, which can make it a lot harder to make the ROI case.
Yeah, I totally agree. And I think it's a really awesome trend to be seeing more like women's specific hardware and apps coming out that are just tracking women's data to help solve that issue overall. I think it's a huge component. And I would also say another thing I see a difference that is across healthcare, but I think in women's healthcare, and because women tend to be the manager of all of their families' healthcare, there's so much fragmentation and access to the data across, you're pregnant, before you're pregnant, you're seeing a fertility specialist. When you're pregnant, you're seeing your OBGYN. The day you have your baby, you switch over to, having a pediatrician and finding a primary care doctor. And then you go through perimenopause and menopause. There's all these different phases of life that women go through. And so the fragmentation of where their health data sits and how they're managing their health is a big challenge and something that is great wide open ocean blue space for people to jump in and build in.
Amazing. And actually, Jennifer, I think the next question also touches on what you mentioned earlier. How do you make sure your product or work stands out in such a competitive consumer market, especially with AI enabling and building? How do you not become one of these plethora in consumer space and not stand out?
Yeah, I think it's a very important question and something you'll answer over and over again as an early stage founder. Like you'll have a really clear idea, and that will change through all the different phases that you go through as an organization for where you find your moats and where you find your niche. And I would just go back to, what Lizzie and others talked about is like being very close to your user, having a really clear understanding of what their problem is and a really clear solution for how you're going to solve that for them. I think no company can come out the gate without using AI. It's just women need to lean into AI. We're like a little, have been categorically a little bit slower to pick that up. So I think it's a great place to lean in, learn more, understand the impact it can have, and also be really conscientious of the security and privacy considerations for that in healthcare. But yeah, I think that there's lots of opportunities to differentiate because women's health has traditionally been underfunded.
And I think you touched on, it's not the focus today, but like the cybersecurity, the data, the use of the data, where does the data go, and sensitivity. And I think it's using AI, but also understanding that you have to be careful because you need to also understand how the AI maybe is using, for example, if you're trying to get customer insights or develop assumptions, where is the data that it's pulling from? So I know we have other questions, but that could be a whole different discussion with the use of AI.
I
I
also
just want
say, oh, go ahead, Mariana.
I was just gonna say, like, find out where your users hang out. Like, are they asking these questions in Reddit, on a Facebook group? Do they have some type of in-person community? Like, how do you plug into where they are, whether online or offline, and just be part of that community, um, rather than just like, posting blanket things on any social media channel. You'll never get anywhere that way.
And also, no one else will have your heart to it, even if they copy everything else. What will the next version be of it? And so that's where it's long game. And to get to the next question of the chicken and egg, for everyone who's a founder or wants to be a founder, save all your money. All your money. Save it. Be smart because funding does not come easily. Nothing is going to come easy. Maybe it will, and you're amazing, and please go have it be easy. But just if you want to be in it for the long time, just try to be smart immediately right now. Yeah, no travel budget, nothing.
And then
Women have a great return on investment. They're great people to invest in because it's shown over and over in the research that women are great for ROI for investors.
To also answer the chicken and egg problem, like if you're solving a really painful problem, people are looking for a solution and they will like be patient with you, especially if you're part of that community with a crappy product and want to be part of the journey. So, it's how do you bring your customers along and things like customer advisory boards are a good way to like, have that type of community connection and improve your get to that perfect product long term.
I know we still have a few questions that are unanswered. I know we're at time. Hillary, how are we doing?
We are going to wrap it up here. I'm sorry that we couldn't get to everyone's questions. Amazing. Thank you, panel, so much. If you have a question pending, feel free to reach out to any of these panelists individually. In the follow-up email, we'll include their LinkedIn info. So feel free to share your question again, and we'll work with you to get answers. As we've seen on this call, like what an incredible example of folks who are committed to the vision, to changing the healthcare system, and to building community and uplifting us all while they do it. So thank you all, panelists, so much. Thank you all for joining us, for listening in. We've got more of these events in the works, so we'll reach out to you about some upcoming events. Um, but nothing else to say, but thank you all so much. What an incredible session.
Thank you.
Thank you so much.
Thank you, everyone, for the questions and great discussion. Have a good day and weekend.